And we're also going to hear from Richard Battles, who's the Director of Respiratory Therapy here. He's going to share a few words with us. And I have a hunch that Richard does an awful lot to help smokers here at this hospital quit. So I really want to thank you for that. We all thank you for that.
So one of the first things I hope I don't do is overstay my welcome. Whenever I get up into an opportunity such as this to talk about things that I enjoy working with, I tend to get up here, and you're going to need a hook sometimes to get me off. So that's fine. I don't mind being hooked off of here. I stand before you, and I probably I have to tell you that I am an aged person. I'm probably about 82 years old, and you really don't have to realize that I'm talking in dog years, but what I'm talking about is what we always used to use as kind of the talking point when we're doing pulmonary function tests on people and we know that they're smoking. We'd say, listen, here's the story. You've been smoking 1.5 packs to 2 packs a year for about a day for about 10 years. So you multiply that times how long you've been smoking, and you add that to your current age. And that's probably how old you are right now. So I'm 82. So I didn't just quit the other day, didn't quit last year, and I'm not a new hero, I'm an old hero. Fortunately, the other side of that story is that they have data that says that if you quit by age 20-something and age 30-something, you gain back some of those years. So I'm a little bit younger than 82, to be honest with you. But for the first thing, what I want to say is I want to congratulate all of the organizations that are involved here. Lawrence General Hospital, Greater Lawrence Family Health Center, the Tobacco Group, for putting everything together, and to be proud of what you've accomplished in the past year, past 2 years actually. But the past year, we are on board at Lawrence General Hospital and made the campus smoke-free, and it's been one of the really positive things that have happened. And as Lisa can attest to, it's a known commodity that if you as an employer convert over to a non-smoking facility, there are a number of people you are going to stimulate into finally quitting. And that's great, and we managed to do that. Now, when you look at this, you have to say, okay, smoking, there's absolutely no question about it. Smoking is one of the most preventable diseases, causes one of the preventable diseases in the country. And when you look back at the history, it was about 1964 when we finally started to look at it and say, oh, you know, maybe there'll be a health hazard, so we'll put a little kind of general statement on a cigarette pack saying, caution, it may be hazardous to your health. And then it wasn't until about 1984 that the Surgeon General, C. Everett Koop, went and put a challenge down to the United States and say, let's make this a smoke-free society. So when we look back at what's happened, and a lot of things have happened in the recent years, but back in those days, there weren't too many things happening to go and inspire employers to go and create a smoke-free environment. And I'd like to be able to say that the healthcare industry took that gauntlet and ran with it, but I don't think we can make that claim because they were probably on about an even keel with the rest of the employers in the country. We're doing the same thing, fighting resistance from our employers, worried that we're going to have them walk out the door, worried that if we make a mandate about something that we're going to get sued. So there's a lot of things that were going on in those days that to maybe give us a little bit of credit for not having done more sooner. But I can tell you from being a long-standing employee at Lawrence General Hospital, and I have been here probably closing in on 39 years. Back, I remember the day when you could go in any room in this hospital, patient room, office or whatever, and we were smoking. So throughout the hospital you could smoke. And oh, by the way, you'd walk into the patient and they'd be sitting there with a cigarette going in their ashtray. And one of the things we had to do is make sure that we disconnected the oxygen in the wall so that we didn't have a fire issue. Now, we were pretty numb about the safety issue, or at least we weren't paying a lot of attention to it, not in those days. Go to the nursing station and the nurses sit there diligently writing their charts. So we smoked throughout the institution. One of my most, I'm not sure I can call it funny, but one of the strongest memories I have is I got a phone call one time from one of my therapists who called up and said, you know, Dr. So-and-so just went into the intensive care unit and he went over and he put his lit cigar on the respirator while he went and leaned over the patient to listen to the breath sounds. So, you know, this is just where we've come from. Now, the fortunate thing here, is that we are making strides. We've made lots of strides, not only in how we view smoking and how we view tobacco abuse, but as healthcare providers, we're also thinking of this in a better frame of mind. Before, I'd sit there and I'd say, hey, you got to quit smoking. What are you, crazy? Look at this PFT. Quit smoking. Kind of judgmental and kind of dictatorial about what you should do. Not a whole bunch of sensitivity, not a whole bunch of support, not a whole bunch of understanding about how'd you get here. So now we've smartened up over the years that we kind of recognize that what we need to do is find these patients, determine their readiness to be able to hear the message, and to give them the message and try and provide support to help them out. And this is what we're trying to do. Let me see, I want to make sure I hit all my high points, all right? One of the things that's often done when you're looking at smoking and allergies, they often will look at it and compare it to the upstream, downstream thing. And when we see smokers that have been doing it for quite a long time, we're unfortunately looking at a person that's probably in the water and drowning. And we try and help them out. And for many years, we didn't spend a lot of attention to try and figure out who pushed them in the first place. Well, now we become smarter in the smoking cessation business in that we also go and we look at it and we say, okay, how can we prevent this going forward? And we realize that kids start very young, and as young adults they're smoking. And when I look back at my personal history, I started at age 13 when I was going to CCD classes, going up Pie Alley in South Boston. I'd stop and have a cigarette then, and I just continued on going that way. And many things were telling me to do that. In order to be a tough guy in Southie, you had to have a butt hanging out of your mouth. You take a look at the TVs and the movies, and everyone that was anyone, John Wayne and the whole bunch, had a butt hanging out of his mouth. Now, all these people died of lung cancer, but we did those things. And I shared with Diane that I love smoking. I enjoyed it. And I used to smoke a pipe, I used to smoke cigars, and I have this picture, and I have it with me if anyone really wants to see, because when I was a young man, the Hugh Hefner in the Playboy magazine used to be, hey, he's the guy that's arrived, and he always walked around with a Meerschaum pipe. So I have this picture of me in Naples, Italy, with my Meerschaum pipe in a pair of silk pajamas. Thinking I must be like, the king of the world. I didn't realize I looked like Elmer Fudd, but what the heck. So the message is that we're smarter. We're trying to help kids now. And one of the girls that works for me, she was talking about a project that her daughter has in school. And what they're doing is they're going in, they're asking the kids to write to different actresses and actors who they've seen in movies and on TV, in movies, where they were having a cigarette. And the kids write to them, and they make a suggestion to them that they come out and they make some sort of a statement about the hazards of cigarette smoking. And they ask them if perhaps they would refrain from taking parts in the future doing that. And what happens is that a lot of these movie stars will write back to the kids, send them back autographed pictures and all that. But what we're doing, we're sending lots of good messages to the kids. If you have parents who are cigarette smokers or tobacco users, and your child may not have a clue that this is not the normal thing. So when they go to school and they get involved in issues like this or programs like this, it teaches them that, no, it's not the accepted way to go. So, we're getting better, is what my message is. Now, the other message is I do think that we have to honor those people who have made the leap. You realize that it's not an easy addiction to quit. And one of the things that we're talking about when we're looking at the analogy of someone a smoker who's in the water drowning, is we're looking for opportunities to pull that person out and to try and get them closer to shore. You may not be ready to quit the habit yet, but if we can move you on to the next step and have you ready so we can reach in and pull you out. The case in point would be in our situation here, when we have patients come into the hospital They're a golden opportunity for reaching out and for teaching. You have a child come into the emergency room, they're having an asthma attack. Mom and dad are there taking care of the kid, and they're very concerned about their child. And oh, by the way, the nurse can smell cigarette smoke off their clothes. Now, if they can pull them aside and send a gentle, appropriate message to them, it's going to be extremely effective. And this is what we hope that we're getting better at doing every day. Now, no matter what, I have to tell you that I think all those who have managed to go and make the leap and get rid of the addiction to tobacco are truly heroes. Now, a lot of cases, people don't necessarily do that entirely for themselves. And this is where I think the true hero part comes in. It could be the mom who finally says, I can't do this to my asthmatic kid again. If I have any contribution to this, I'm quitting. It could be the spouse who knows that their husband just got diagnosed with some sort of cardiac issues. And oh, by the way, they both are smoking, so the spouse will go and quit so that the husband can quit who may have just had an MI. These people can be truly heroic. So they do need to get credit. And I think the institutions who go ahead and say, okay, we are going to make this a no-smoking facility, and we're going to commit to helping all those people who are addicted to tobacco to get rid of it, they are heroes as well. And I thank you all.